Francis. Good morning. My name is Melanie. I'm going to be your nurse today. So I understand you're having some back troubles. That's too bad. Could you please verify your full name and date of birth for me? Okay, great. Thank you. So you're going to be having an MRI to assess your back and maybe figure out what's wrong. And you're feeling anxious about that, the enclosed spaces. That's understandable. A lot of people feel that way. So I have some medication I can give you for that. Before I give it to you, though, I need to just take a look at your IV. So his IV looks good. Okay, Francis, I'm going to go to the med room and grab the med, and I'll be right back. So I discard my gloves, scrub out, and now I'm headed to the med room. So once in the med room, I have pulled Francis up on the computer, and I have pulled the medication up out of the Pyxis. So he's going to be taking 1 milligram of lorazepam. So I've dispensed this bottle. It's 2 milligrams per milliliter. This is a 1 milliliter bottle. And then I also have these are 3 pre-filled normal saline syringes, 10 ml. This doesn't look like 10 mLs, but it is. They're all the same. So I have these. So I'm going to set 2 of those aside as my flushes. And then I have another needle here. So, okay, so I did my first check. I pulled everything up, make sure I'm doing the right medication for the right person, my 5 rights. Then I'm going to draw the medication up. So the first thing I would do is I would take an alcohol swab to the top of the medicine bottle. Remove the cap. I'm going to take in 0.5 ml of air. And then squirt that into the bottle and then withdraw 0.5 ml of lorazepam. Then I'm going to recap that using the scoop method. And I'm going to label it. And the label says the dose, 1 milligram, lorazepam, the name of the drug, and the date. Then I'm going to take the needle off the saline, the cover, take the cover off the saline, excuse me, and I'm going to take my cover off my lorazepam, and I'm going to draw up 0.5 ml of normal saline. Sorry, I just was putting my label back on.
Yeah.
So now I have 1 ml of contents in my syringe. It's 0.5 ml of normal saline and 0.5 ml of lorazepam. I'm going to cap it using the scoop method once again. I'm going to discard this in the sharps. Now I'm doing my second check, making sure I did everything properly, making sure my dosage calc was right, and that I have the right patient, right medication, route, frequency, time, and so forth. So that's check number 2. It's a high alert med, so I'm going to get another nurse to do another independent check for me. Excuse me, Kim, could you come verify my medication, please? Kim, I'm doing medication for Francis. It's 1 milligram of lorazepam. Can you just double check everything for me? Okay, so there's my independent check for high alert med. So I'm going to take off my gloves. I'm going to wash my hands. And I'm going to take my lorazepam and my 2 flushes. And I'm heading back to Francis's room. Hi, Francis, I'm back. Scrub in. These are new gloves, by the way. So the first thing I'm going to do is I'm going to do my third check at the bedside. So I'm going to double check my medication against my record. Yep, everything's good. Then I'm going to scan the bracelet. Beep, beep, in the med. I'm going to remove the cover. Can you see it? Mm-hmm. I'm going to remove the cover and scrub for 15 seconds with an alcohol swab. Let it dry for 30. Then I'm going to remove the cap of my lorazepam. That is not true. I'm going to flush. So I'm going to flush with normal saline, 3 to 5 mLs of normal saline. Discard. I'm going to clean that one more time. Then I'm going to remove the cover of my lorazepam. And I'm going to administer the lorazepam over 1 minute. And over that 1 minute, I'm going to educate him about this medication. Francis, this is lorazepam that I'm giving you, and this is going to make you feel sedated. So you're going to feel probably drowsy. You'll feel relaxed. It should really help with your anxiety. It can also make you a little bit dizzy and lightheaded sometimes. And so for that reason, I want you to ring your call bell if you need to get up or use the bathroom so that one of us can come and help you, okay? We don't want to take any risk of you falling, okay? So there's that. Now I'm going to clean the plate again. And I'm going to flush again. Then I'm going to clean again. And then I'm going to cover it. I did not just do that with a dirty cap. I cleaned it the last time. Then I got my new cap out and put a new cap on. You notice the whole time I held the clave up so that it doesn't touch anything and get tainted. There. So Francis, you're going to notice an effect probably within 15 minutes or so. It works pretty quickly. But I'm going to come back and check on you within a half an hour, okay? So, can I get you anything before I go? Would you like a blanket? Are the lights the way you like them? Okay, great. I'm going to lower your bed to the lowest height. I'm going to lock the wheels, raise the rails. I'm going to make sure you have your call bell right here, okay? So I will be back within 30 minutes. The end.